Mendocino County. Welcome to today's Friday COVID-19 update. We're going to be focusing on the health order enforcement. We have a number of guest speakers with us here today. We have Mendocino County CEO Carmel Angelo, Supervisor Ted Williams, Sheriff Matt Kendall, Chief Investigator John Martier, Code Enforcement Officer John Burks, NCO Executive Director Patty Bruder, and Willits Chamber of Commerce Executive Director Ron Moorhead. So we'll start off with a discussion about our education and outreach efforts, and I'll turn it over to CEO Carmel Angelo.
Thank you, Sarah, and thank you to all of our guests that are with us today and our panel. It's very much appreciated that you're able to take your time this afternoon to work with us, inform the media, and inform the public. So thank you very much. We do have a full hour and a half ahead of us, and so I wanted to just take a couple minutes to explain the process that we have. You know, public health is really about prevention efforts, and part of the prevention efforts are outreach and education. And we have done a considerable focus on enforcement, and you'll hear more about that this afternoon. What we do know about enforcement is it doesn't matter how much or how little you do, there's always a need for more enforcement. But public health is about prevention and education and outreach. And if we could increase our efforts around outreach and education, then our hope is that we could reduce the need for enforcement. So it's basically working on the front end with outreach and education to reduce the need for the back end, which is enforcement. And we have been very fortunate here in Mendocino County that we have had community-based organizations step up. And I would like to say that two of those organizations are North Coast Opportunities with Patty Bruder, and then the chambers, and that's all three chambers. And they have stepped up, and Ron Moorhead has reached out to Supervisor John Haschak in the 3rd District, who asked him to call me. And we now are enhancing the chamber's efforts and really thankful to them that they're moving forward with a campaign called Mask Up Mendo. So the chambers are working more on a global basis as far as reaching out to the public. And then Patty Bruder has stepped up and talked with us about reaching out to targeted groups. We know that we have a high rate of positivity for COVID-19 in the Latinx population. And so North Coast Opportunities is working on a campaign to outreach to the Latinx population. Additionally, they are also outreaching to the youth. And so we're very fortunate because we have these community-based organizations that are stepping up, with NCO being targeted with the youth and the Latinx population, and then the chambers doing the overall county. So without anything else, I would like to go to Patty Bruder first to talk a little bit about what their plans are, and then to Ron Moorhead to talk about the chambers, and then we'll get into enforcement. Thank you.
Well, thank you, and I'm happy to be here today. NCO is our local community action agency, and it's an agency that is really here for all of us, and we look at ways to make our community stronger and better. And I know that we're all learning from this COVID experience, and we're learning about what works, what doesn't work, and how is it that we can get back on track, be safe, be healthy, get our communities, our economy opened again, and stay open. And we've learned that there's some simple things that we can do. We can wear masks, we can wash hands, we can social distance. And these items are things that we can do that will make a big difference in getting ourselves back on track. And so NCO's philosophy is really to work within the community and work with people of the community. And we are going to do some targeted work with the Latinx community. We're not going to be doing this to the Latinx community. We're going to be doing this with the Latinx community. And we're working closely with UVA and other organizations. We're just really beginning and going to do some targeted efforts about why it is that we want to wear masks. We want to also help the youth. We know that youth, we can tell the youth all we want, what we want them to do, but we're really way more successful if we work with them directly. And so within these two communities, we're going to reach out, work with youth, work with the Latinx community, find ways to reach their communities that work for them. And that's part of our targeted effort. We're really just forming our efforts right now. We're going to be able to invite community groups in to do some of this work and be able to give them some resources where they can do their own projects. This may be in the form of videos, it may be in the form of working together. I know our youth are really involved in online learning, which is a really tough thing for people to do all the time. So we're trying to find ways that some of this work can be part of kids' schoolwork. Maybe have some giveaways for people, for youth that write essays about why you'd want to wear a mask, or look for ways to involve people. So if anybody is out there is interested in helping us with this effort, we welcome you, and we will provide resources to you to help us educate our community. And it really is about, it's up to us. We have a lot of control over this if we only join together, do what we need to do, and keep each other safe.
Thank you. Ron?
Well, the Mask Up Mendo program came about with a consortium of the three chambers that we decided, looking at what the county was trying to do and looking at the pressure of enforcement. We followed how some of the cities and how it was so difficult for individuals within the government to be able to say, we're going to go out there and we're going to enforce this mask and cite people. And we saw the knee-jerk reaction. So we looked at how best to go out in the community and be the community resource that we could be. So the Mendocino Coast Chamber, the Ukiah Chamber, and the Willits Chamber got together, and we started this program to to go out and talk to, number one, the businesses, and let them know that we're on their side and how important it is for them to get their customers and their clients to mask up. We want to keep our businesses open. And in this whole process, we said to ourselves, what are the reasons for it? It's not just health. It goes far beyond that. It goes to business and keeping our businesses open and strong, keeping our employees within a job so that they have the funds to be able to pay their rent and pay their bills. The tax situation where the cities, if they do not have the money coming in, and the county where they are able to provide their services, it all fits into this one little thing of, let's try and control COVID-19. And the one way we have to be able to do that is get people to wear masks. So we talked with Supervisor Hashak and we talked with CEO Angelo, and they both agreed that it would be a good program to work in a partnership with. So we took off and we started putting this all together. We will have ambassador volunteers out visiting all the businesses to explain how important it is for them to get their customers as they come in. If they do not have a mask, then we were able to partner, thank goodness, the EDFC, and they acquired masks and hand sanitizer, which will be able to supply the businesses and organizations so that if they have clients, customers that do not have masks, we can have their businesses give them a mask to come in and continue to be in their store legally and not have to worry about any kind of enforcement. So it's kind of a grassroots effort to be able to say it's really important to wear a mask, not just because of the health, but because of all those other issues, and educate the business owners as well as the general public. We will have information stations placed around the county where, say, Glass Beach over on the coast, where there's lots of tourists, and we can give them the information as well as provide the sanitizer and masks if they don't have masks, so we can get that whole message across to so many more people. We'll do that across the county, Safeway in Willits or Ukiah. We're working with the outreaches of the county, been in touch with Covelo, Leggett, Laytonville, Point Arena. So we're going to all of the corners of the county to be able to have everyone participate in this program. One of the kind of fun things that we thought that we will do, which we're going to, is it's called Mask Up, Post a Selfie, where if you post a selfie of you in your mask in front of either our posters or a local business or a local landmark, put it on social media, our social media, and you'll be entered in to win some fabulous prizes. And we're working with the businesses across the county to be able to supply those prizes. So it's kind of a fun thing. So if you're out there and you have your mask on and you're at a place where people will recognize your favorite business, it's a chance to be able to have some fun and win prizes as well. So the one thing that's probably the most important as far as distribution is contact your local chambers of commerce. We are the three main distributors for the goods for businesses. So we have hand sanitizer and the masks, and we'll get those out to other places. The Laytonville Fire Department has said that they will help. The health services in Covelo is going to help. So there's going to be a lot of places where businesses mainly can go and get their supplies so they can easily give their clients and their customers masks to hopefully curb this COVID-19 that is crippling, and we can keep our businesses strong, healthy, and open. So that's about all I have, unless we have questions.
Thank you, Ron. Well, there may be questions here in a little bit. Again, this is our grassroots efforts that are led by the community. And, you know, it's apparent that public health didn't create this problem. Public health can't solve this problem. This is a community problem. And we need everybody to step up. And I can't say enough how grateful I am to these organizations that are stepping up and that are providing the outreach and education in our communities. So thank you. So with that, let's move on to enforcement. So I'm not sure that the public understands the different arms of enforcement that we have in the county, but there are different arms. And that's what we wanted to do today. We wanted to talk about who's doing what so the public knows who to call, when to call, how to proceed. And we do have different offices that are responding. We actually have, I think, a fairly good number of people who are working in enforcement, but I will say this again, there's never enough enforcement. And so here we are. So what we have is we have John Martier, who is our chief of the Special Investigations Unit. And Mr. Martier is actually the lead for enforcement for the health order. And what he does, or his unit does, is calls come into the county, whether they go to the sheriff's office to dispatch or whether they go to the call center or whether they come to my office, wherever they go, those calls, if they have to do with enforcement, they are sent over to Mr. Martier and the Special Investigations Unit. That unit then triages those calls. And if it has to do with, if it's, and I will say this, that unit is 7 days a week, but they are I think it's 8 to 5, but John could correct me when he speaks, but I believe it's 8 to 5. So during business hours and on the weekends, if those calls come in, they are referred to Special Investigations Unit. They triage those calls. After hours, if it's an enforcement issue, those calls can go to dispatch. And Sheriff Kendall may speak about that a little bit later on. So that's what the Special Investigations Unit does. And Mr. Martier will be speaking here in just a couple minutes. the second arm that we have. And so Special Investigations Unit, triaging those calls, people, gatherings, masking, not masking, that's what they deal with. The second arm of enforcement is with the business community. And this is under our code enforcement unit under the director, Trent Taylor. And we have John Burks with us today, who is the code enforcement officer, who is, I'm not sure if John is leading this in the code enforcement unit or if he is just replacing Trent today. I'm not sure, but Mr. Burks will talk about this. But what the code enforcement unit does, they enforce the public health order by working with the businesses. And if we get complaints about a business that's non-compliant, then that call is triaged over to the code enforcement unit. And that's what they do. They work on an administrative process, a legal process, and they work it through our system, and they work with our attorneys, with county counsel. It's actually very effective. Fortunately, they don't have to do a lot of legal work with our businesses, but that is a hammer that's there. And so I want to make sure that we understand we have enforcement that responds to businesses, and we have enforcement that responds to the people that are having a party that they're not supposed to have, or the people that are just walking around unsafe to others. Along with that business arm, I do want to say that we also have environmental health under Trey Strickland, and they are working with county council and with our health officer on a business outbreak process. And so it's environmental health that will now be the responding arm to businesses that have outbreaks that the health officer thinks that there needs to be additional work done. And so they will work with that business, and they will also do an investigation if needed, and they'll also do a visit at the end before that business can open. So again, that's environmental health. And then lastly, we have our sheriff, Sheriff Matt Kendall. And what Sheriff Kendall does, I will say, is all things enforcement. And so many calls are referred to the sheriff and the deputies because it's after hours or there's no one else to respond. And so Sheriff Kendall plays a key role in our enforcement efforts. And so those are the three different arms. And also, you know, we don't have the city police departments on here, but Sheriff Kendall works with those city police departments, and they work and they communicate regularly on enforcement of the health officer order. And we also have Supervisor Ted Williams in the 5th District with us today. And the reason that we specifically have Supervisor Williams is twofold. One is that we find that many people call Supervisor Williams with their concerns around enforcement. And he is quite the thinker and has really helped us problem solve through some of our enforcement issues. And so we have asked Supervisor Williams to actually moderate this panel. And he has some questions that he will be bringing forward to Sheriff Kendall and John Burks and Chief Martyr here in just a few minutes. So what I would like to do right now is go to Sheriff Kendall to speak for a few minutes about anything you'd like to say or anything that you do around enforcement, and then to Mr. Martyr and Mr. Burks, and then turn it over to Supervisor Williams with questions for the panel. Thank you.
Thank you, CEO Angelo. Matt Kendall, Sheriff. Our enforcement is somewhat based on the availability of the deputies that we have to be able to put on it. Currently, we still have one deputy on it who's from our bailiff unit. When the courtrooms suddenly were condensed down a little bit due to the fact that COVID-19 was a concern, we wound up with a couple of bailiffs that we were able to use and put into places for directed enforcement. The remainder of the enforcement is based on calls for service or patrols that can be done during times when the deputies are not handling calls for service. But due to the geography of our county and the number of deputies that we have to remember we can't be all places at once. Currently, the coastline between the South Coast and the North Coast, we've got almost 90 miles of road that we need to patrol there. And then the inland sectors between Ukiah and the North sector, we've got roughly 107 miles one direction that we have to cover there as well. And so as the calls come in, when we find ourselves with the availability to patrol or to handle these calls for service, we do so. A lot of the calls for service that we're having are dealing with gatherings, and a lot of them are gatherings in people's homes and whatnot. And although that we can go contact them at their homes, in order to enter the homes and be able to take enforcement action, we have to have basically a search warrant. And that's a pretty tall order when you're handling calls for service, because we can't just peel off, go write a search warrant, and then go in for something that we have to give them 24 hours notice on. Now, the masking violations with the new ordinance that County Council and the Board of Supervisors were able to put together, we've taken that 24-hour rule out of the effect, and a person who refuses to mask can be cited for refusing to mask with no warning and without the 24-hour notice to comply. So that's kind of where we're at the Sheriff's Office. And I guess I can hand it off to Chief Martier.
Thank you, Sheriff Kendall. This is John Martier. I'm the Chief Investigator for our Special Investigation Unit, which is from the Health and Human Services Agency. My unit is comprised of 5 sworn peace officer investigators who, before this crisis, our primary duty was to investigate allegations of fraud against our public assistance programs, the CalFresh, CalWorks, and the In-Home Supportive Services program. When this incident began, we were then tasked with assisting the Sheriff's Office in a task force approach. We were proactively looking for violations of the public health order. We were traveling throughout the county. We were responding for calls for service. As the public health orders evolved and some of the restrictions were relaxed, our goal is still the same. We are available 7 days a week from 7 a.m. till 5 p.m. And I have investigators throughout the county whose job, as CEO Angela pointed out, is to respond to calls for service. We receive those from the community who calls into the call center, and then those are forwarded to my unit, and we triage them, and we network very closely with all of the code enforcement units, whether they are from the city or for the county units, the police departments and the sheriff department. And we respond to those calls and take the appropriate action, which in most cases is educating the public and going from there. So we're very active. I'm proud to say we do have 7-day-a-week coverage, and we're kept quite busy with the calls coming in. So I think then we'll give it over to Mr. John Burks for the county code enforcement perspective.
Thank you, Chief Martier, CEO Angelo, participants and community that I serve. Thank you for putting this together. So currently, Trent Taylor is the interim manager. I am the acting code enforcement supervisor, and I field any of the health order violation complaints that are triaged and determined to be within our jurisdiction from the DOC call center, SIU, and Chief Martier. So the way that we're structured, to give you a little bit of feedback on how we normally work before COVID came up, we have one inland traditional code officer, we have one coastal code officer, and we have 2 code officers assigned to cannabis cultivation, whether that be permitted or not permitted. So now that we're doing some of the health order complaints, the way that we're structuring that is that I'll receive the complaint, I'll log and assign it to the available officers. Given where they're located, we will have all of our staff focused on that. That's our primary priority at this moment, is anything health order related. So on any given day, they're all doing something investigative as that relates to the health order. So the way that we structure our due process is we'll receive the complaint, I'll do a little pre-investigation and assign it, which usually includes the who, what, when, where, and why. And that's everything from Facebook posts of potential events to businesses not complying. That's what the complainants are describing, vacation home rentals. After that, the investigating officer typically will make contact, preferably over the phone, make an appointment. And if we're not able to do that, we'll go in person and make contact and discuss the situation with them and see what we observe while we're there. We do our best to provide information and educate those folks when we do make contact. So we always go with the health order printed out, the face covering orders printed out, and anything that may apply specifically to that business. Lucky for us, everything is available on the website, on the county website. So we use that as our main tool to be able to convey the information. And then at that point, once we make contact with the owners, operators, we'll discuss everything from their business license, the self-certification, which is required for them to operate in the county. And if they have any questions, we, if we are able to, we'll field them through code enforcement, and if not, we'll refer them back to the DOC for any kind of determinations or clarification, even, if the public health officer needs to weigh in. And so once we have that conversation, education is our best tool, and it is extremely effective. We've had a ton of success. I'll cover that in just a second. So after the initial contact, we'll go back for a follow-up inspection to confirm that all the protocols are in place and that they feel comfortable with the way that things are operating. Make sure that that the businesses know that they're empowered and by the health order as well, that it's not entirely restrictive, that it gives them an opportunity to serve the community as well. So we try to make that clear. And then after we have that inspection, if there's any, questions as far as code enforcement goes, we review the evidence and seek a determination if needed. And so far, we've only had to issue after that 2 notice of violations and 1 citation. So out of all 103 cases that we've had, we've been able to close 101 of them so far with compliance. So there's only 1 active investigation and the 1 citation that was issued. And that pretty much in a nutshell is what we do, and I'm open for any questions. Thank you.
Okay, I think Supervisor Williams, can you take over from here?
Oh, I would love to. Maybe we could ask these same questions of all of the enforcement representatives today. Are you tracking the leading causes of spread within our county? And how does your leadership address these causes? You want to start, John?
Well, there's 2 of us, but I'll jump in for code enforcement. Hello again. Thank you. This is John Burks, code enforcement. So we don't typically in code have any contact with positive cases or spread so much. We're mostly on the front end as people are observing the potential violations. So nothing has happened yet typically with whom we're dealing with. But I think that the leadership is very, very good from the top all the way down to our actual code enforcement officers. And that's reflected in our success so far with compliance. Thank you.
I appreciate that. For context, what I'm trying to get at is I imagine enforcement from all agencies is overwhelmed. There are far more complaints coming in than we can follow up on. And perhaps it's useful to have public health direct enforcement to the pain points where we see the most spread or the most likely chance of spread. Do you feel like you're getting that support?
This is John Martier. I'll go ahead and answer that. Yes, I do. I attend daily meetings, and we talk about our contact tracing, and we talk about where the numbers of increased cases are coming from. And that kind of directs our enforcement. We do get a lot of complaints on the coastal areas where there's a lot of tourism in the county. And those seem to be snapshots in time. And what I mean by that is somebody observes somebody not wearing a mask. And, by the time that complaint gets down to the investigators and we dispatch them out to that location, a lot of times that person is gone. Through our patrols, we've noticed in the town of Mendocino, for example, there's a high level of compliance with the masking. Overall, we're very pleased with what the public has been doing. But in terms of where the numbers are increasing, I think we can say the worrisome spot for us is the increased gatherings mostly in our populated areas, which, the city of Ukiah is the largest population in the county. So as we see increased numbers of gatherings going on, we're going to target enforcement there for what we can see and be able to respond to those complaints in a very timely fashion. So that information does help me as to where we can allocate our resources to improve the enforcement efforts.
Sheriff Kendall?
My response to that would be that I believe that the information that's coming out of the DOC is always extremely on point. And the fact of the matter is we can see the areas that are causing us the greatest problems. A lot of these areas are based on the culture within your home. Some families believe that their family is that nuclear family inside of their home. Some families believe that their family is extended out to cousins, grandmothers, things like that. And so there is some confusion, and education has served us well, especially on these gatherings, that, just because the health order says you can stay within your family unit, it's not that extended family unit with 30 to 40 people. I have a very large family because I had so many brothers and sisters. But I think that we're going with education, we can change a little bit of that culture. And instead of, going to my father's house with 28 people that are in my family, we can make sure that people understand that your family unit is that nuclear family under one roof.
Do you have adequate resources to meet the objectives? And how can we better support your efforts? And I guess by we, I mean county administration, board of supervisors, the public at large. How do we collaborate to make sure you have what you need?
Well, I can start with that one. The sheriff's office historically has had to collaborate with other law enforcement agencies to meet the goals. And that is on a daily basis. That's not just during the pandemic. All enforcement agencies within Mendocino County are running very short on personnel. It is not just the Willits Police Department, Fort Bragg Police Department, or Ukiah Police Department. Everybody is running down large percentages, anywhere from 25 to 40% down on manpower. But we are so accustomed to working together as force multipliers that we're able to get some of these things done. But we have to remember there was too much work going on prior to the pandemic, and crime has not slowed down. It has grown. And so we're at a new point where we're trying to stretch resources right up to the bitter end. And by collaborating, we should be able to get through it. But everybody has got to be all hands on deck, and we have to work together.
Code enforcement?
Yes, thank you. We've been successfully managing the health order response here at Code Enforcement. As you know, there's only 5 of us and Trent Taylor. So I feel like with what the DOC has been referring to us, we're definitely able to respond to those very quickly. They're certainly our priority. Like the sheriff says, we're up 30% on our traditional complaints and our cannabis complaints combined. So those may be, not suffering, but the time in which we have to respond to those is extended. And I've heard from the community that they have some concerns about that. But at this moment, we are able to stay on top of the health order complaint workload. We're pretty confident in that.
Is there anything the public should keep in mind when filing complaints that makes your job more efficient? Is there information you want included, or is there a type of complaint that's most actionable?
Yeah, one of the things that really helps us out is to submit it in writing with as much detail as that you have, so there's less follow-up. And then if they're able to include their contact information, I would just like to let them know that it's confidential. The only reason why we ask for it is so that the investigating officers can actually reach out and ask follow-up questions if need be. And that's a tremendous help, because sometimes when there's any kind of vague information, then seeking that out is what takes the most time.
And SIU, I imagine for responding to reports about people not wearing masks, by the time you get there, the subject may already be gone. How is that going, and what should the public keep in mind when filing those types of complaints?
Yes, thank you, Mr. Williams. That is correct. A lot of these quote in progress calls, by the time it gets dispatched and we get somebody out there, those subjects are gone. So, the public needs to remember we do our best to be out there. We are observing, but it does take time to respond. I have usually anywhere from 2 to 3 investigators for the entire county. And as Sheriff Kendall pointed out, we have a few miles to cover. So it takes us a little bit to get out there. But in terms when they report something, I want to go back to your question to code enforcement. Please be as specific as possible with a good description of what's going on, the who, what, where, when, and whys. Try to answer those questions. Try to give us as much information and specificity as you can, so that when the investigator gets out there, we have a good chance of determining what's going on and who's committing the violation of the public health order. In terms of resources, I've had to redirect my entire staff to COVID enforcement. And this is a national emergency, a state emergency, a county emergency. So although that's fine, we're not able to get to what our core investigations are. So, and we're not able to cover after 5 o'clock in the evening. So in terms of resources, it would be nice to have some additional staff that we could assist other agencies for longer periods of time. That said, and I've been in this county a short time, only about 20 years now, I have never seen cooperation amongst all the law enforcement agencies in the county like I have now. I don't believe there's a week that goes by that I don't talk to one of the chiefs or the sheriff or anybody else in those law enforcement agencies. We are all on the same page, and we are working together in unison to enforce and educate the folks in this community. And my hat's off to everybody, because I think we're doing a very good job with the limited resources that we have in this county. I do believe it's making a difference.
Do you get many complaints about people not wearing facial coverings in public outdoor settings, beaches and trails?
Mostly in those populated areas, trails and beaches. Not so much in the business districts. Usually, let's say it's a beach setting, by the time we get out there and take a look for those people, either there's a fair amount of people on the beach where it's hard to locate those people, or they're simply walking through and they're gone by the time we get there.
And I think there's been some communication, and it's perhaps an area we could do better with outreach, that the facial coverings are for our indoor settings or outdoor where the 6 feet of distance can't be maintained. And I know I've heard some complaints about there's a man walking out on the beach without a facial covering. But if he's 100 feet from anybody else, that's not a violation of the health order, is it?
No, it's not. And I would say that a lot of the complaints that we receive are a misinterpretation of what the public health order is saying. And it's not saying that, for instance, we have people that have called in and said, somebody was driving a car through my neighborhood and they weren't wearing a mask. Well, that's not a violation of the public health order. Or if there's nobody around them in a public setting and everybody's further than 6 feet away, that's not a violation. And we still get those calls. And so it's an educational process for us to notify that individual that's complaining that, maybe you misunderstood the public health order, and we try to educate them and follow that up with them.
What percentage of complaints from the public have been substantiated, ballpark?
According to my, this is John Martier again, according to my statistics that we've been keeping from April through the end of June, it looks like about 30% of the complaints needed some action, and the majority of actions that we took were simply an educational action. The person was not aware of the public health order.
Sheriff Kendall, is that about the same for the sheriff's office?
I'd say that that's fairly accurate, especially when we make stops on people who are from out of the area. And I'd say that especially on the holiday weekends, 1 out of 3 people that we contact are from out of the area for traffic violations and various other things. Calls for service are almost all 100% homegrown people, with the exception of someone had a theft or something. And I'd say it's roughly 30% people who had no idea what our health order was at the moment, things like that. And we have to remember that when we first began this, health orders were different all over the state. And so if they left from Shasta County, by the time they got here, they had been through 4 counties with 4 different health orders. Now, one of the wonderful things that we've done in Mendocino County with the guidance of Dr. Doohan was to make sure that we get on the same page as the entire state while still remaining in control of our destinies in Mendocino County. And that's been very helpful, because now that the state orders are kind of causing everything to come into line, it's easier for us to lean back on those and say, you should know these things because they're statewide.
And I imagine for code enforcement, it may be a different ratio due to the focus on businesses and facilities as opposed to individuals.
Yes, Supervisor Williams, thank you. That is correct. 92% of our investigations, we did find some sort of violation, whereas the remaining amount were maybe not as reported. And more often than not, it was the businesses were complying with some aspects, but not all. And we were able to just help inform them, and they were able to comply fairly quickly because none of it's very complicated.
One of the most concerning types of reports I've heard from the public is details about parties happening. A lot of these are backyard music, people gathering, maybe they're friends or family, but large number without facial coverings. Where does that get directed? Is that for code enforcement or SIU? And a lot of those parties take place after 5 p.m. when I think it's more difficult for code enforcement and SIU to respond. Do those fall over to the sheriff's department, or what does that process look like?
Supervisor Williams, what it looks like is basically it's triaged by either SIU or our dispatch department or dispatch offices. And then it goes out to the agency of jurisdiction. If it is occurring at the city park in Ukiah, it'll be sent out to Ukiah PD. If it's occurring within the unincorporated areas of Mendocino County, then of course it would go to a deputy. But upon the triage of it, then we have to also triage what do we have to be able to have the ability to send it to it right now.
I had a call earlier, and this represents a common question of a gentleman was asking, is this a recommendation or does it have the full force of law, the facial covering? And I think there's still some confusion out there. And if you get a look on social media, there are a lot of complaints about it not being constitutional. What maybe all 3 of you could voice your current understanding. Does it have the effect of law? Is it constitutional? Is there any concern about enforcing the facial coverings?
I can start off on that. The constitutionality of this will be tested eventually. I don't know when litigation will be seen on it, but we've already heard throughout the state and throughout the United States a lot of saber rattling regarding the constitutionality of the orders. And a lot of it is based on the 14th and 18th Amendments. And we'll see where that goes. But as far as the masking ordinance that was put in place by the Board of Supervisors, it is not a draconian law where you have to do this every time that you're out. People have a lot of choices. You can choose not to mask if you choose not to go into a store. You can choose not to mask if you choose not to go within 6 foot of another person. There's all of these different things in there where people have choices. And especially with we've had some people who do have some medical issues. But even those folks have been very good about saying, well, I can't wear a mask and therefore I'm not choosing to go into that store and I'm not choosing to walk down that trail. So.
Yeah, I'd like to echo the sheriff's comment on that. We have been challenged by a few people out in the community about the legality of that ordinance. And our approach has kind of been an educational one, that the Board of Supervisors pass that ordinance with the procedure that's given to them that's allowable. by the law. And I think eventually down the road, some of these things may be challenged at a higher court. But the people that have given us some issue initially, once we discussed it with them and give them some options, such as not having to go into the store or remaining distant from somebody else, social distancing, they seem to understand it at that point, and they've not challenged that any further. So through our experience, through educating the folks and just kind of explaining the process of how all this developed, we've been able to garner compliance thus far. But I will tell you this, the longer this incident goes on, and I'm afraid this is going to be with us for some time, people get they're starting to push back more and more. And I think this is going to become more difficult for the enforcement of these ordinances as time goes on. People are just simply tired and frustrated.
John?
Thank you, sir. For code enforcement, when we work with the businesses, I think that they were hesitant at first to tell their customer base that they had to require, or that they were required to wear a facial covering, and they were uncomfortable about the concept. But as we educated them and informed them that, we're backing them and that it is a requirement, and that took any kind of question away, I think they certainly felt, better about it, maybe, I don't know, limiting their own liability. So once they put up the signage and, worked with their employees to be able to, let the community know and their customers know specifically that they must, and that many of them offer accommodations for those who are not able for some reason to wear a facial covering, to, do curbside or something like that. So we haven't really had too many, issues. Once we let them know what the requirements were, we were able to get compliance.
I appreciate the three of you coming on. Clearly, you're combined are leading experts in enforcement. You're out there in the field, and you have a snapshot of the entire county, so that we can reflect back later on how we're doing. On a scale of 1 to 10, 10 being the best, how would you rate the current success on enforcement?
I believe that we're running at about 85%. And strangely enough, we in law enforcement deal with the 85% rule all the time. Believe it or not, when they do speed studies on highways, they have an engineer go out there and check the road surface, and they check the curves. But the last test that they do is they set up some of us are old enough to remember those little tubes that went across the road, and those were actually speed tubes. And they found years and years ago, and it's still true today, that 85% of the general public will drive at a speed that is comparable to what the road will allow. Now, that doesn't mean that 15% are speeding. You'll have 6 to 7% that drive well under the speed limit, because that's what their abilities are. And then you'll have 7 or 8% that drive over the speed limit based on what they believe their abilities to be as well. And so 85%, I'd say we're well into that 85% range. Based on what I've seen in various communities from the South Coast to Covelo, I'm seeing compliance, especially with the masking, at a greater level than that. But, just like anything else, when we educate people, laws have to be based on what's reasonable and what's justified. And that justification comes in when we educate people, and then those laws seem a lot more reasonable to the people who are abiding by them.
1 to 10 scale, Sheriff, where would you say we are on effectiveness at addressing that 15%?
I'd say that we're probably in a 75% range. And I base that on the number of contacts we've had where we haven't had to contact them again. Yeah.
Code enforcement, 1 to 10?
I'm confidently at a 9, only because the caseload has been decreasing and less complaints. I'm hoping that the public will let us know through the DOC, where the areas need to be addressed. And as that decreases, I think that's the best way to measure this.
And John Martyr?
I have two numbers for you. I think what we're doing right now, I would give it an 8. I think we're effective. I think we're responsive to the complaints. If I took a look at the entire picture and what possibly could be done, I think I would just drop that to a 7, only because of our limitation in the time coverage that we're able to provide for the enforcement. And you know, if we had additional resources where we could expand that a little bit and not have to depend on law enforcement, who has all these other calls that they have to respond to and whatnot, we may be able to do a little bit better. So I have to break that down into an 8 and a 7 for you.
Thank you all for your time, and I'll hand it back to CEO Angelo.
Well, thank you to the panel, and thank you to our guests as well, Ron and Patty. And I want to especially thank Supervisor Williams for taking the time to work with us today. So nobody go away. This is our media event. And so Sarah, I will turn it back over to you. Thank you.
Hello, everyone. So now we're going to move on to our Q&A period with some of our local media. We do also have Dr. Naomi Doohan on the line to answer any questions, and Becky Emery, who's our Department Operations Center Manager. So up first, we have Sarah Reith with KZYX. Sarah, go ahead. And I think you're muted, so you...
Can you hear me now?
Sure can.
So today we had some more deaths reported, including one this morning from Sherwood Oaks. And I'm wondering if Dr. Doohan can talk about the effect that she expects this to have on our health system with some of those patients going into the hospital, if we can expect the state to come in and start looking at our nursing home facilities. What's changed this week with the increased number of cases and deaths?
So we've been meeting weekly with our skilled nursing facilities for months, and our skilled nursing facilities have been meeting regularly with the state. So there's not a change in the meetings and connections that we've been having, other than we're meeting with increasing frequency. So we're now meeting twice a day with our county, with our MOAC branch, with our EMS partners, with the hospital, and with the skilled nursing facilities that are, right now we have one that's really experiencing some very great challenges, which is Sherwood Oaks. So we met this morning, and we're going to meet again this evening with the Sherwood Oaks, with this team that I mentioned, including the hospital. Sorry, am I speaking too fast? Sorry. I apologize. What we're doing now is a coordinated response with Adventist Health and with Sherwood Oaks and our MOAC and the county, that there have been patients transferred from Sherwood Oaks who have COVID to the hospital in Fort Bragg. And that is a active, let's say, response that is in process. So there were 3 transferred yesterday, and that is to strengthen the response of Sherwood Oaks. Also, the state has provided a strike team that's come in it's a state resource that the MOAC got to come in and help with staffing at Sherwood Oaks, and that staffing is going to be here till Monday. So it's an active, actively evolving situation, but there are many partners responding, and we're doing our best in a very difficult situation there.
Is someone else in line behind me for a question, or is it time for me to ask my second one?
You can go ahead with your second question.
Okay, so I see that we have an ASL interpreter, and that's really great. Last week, there was a media blitz in Spanish, and I'm wondering if that was a one-time event or if we can expect more of these events to be translated into Spanish as well.
This is Sarah Duquette with Mendocino County. It wasn't a one-time event. We're working on a strategy to do more videos in Spanish and also provide recaps and updates in both English and Spanish. And so we will have some additional information later this afternoon and tomorrow in Spanish. So we are working on that strategy, and you should expect more Spanish context and more Spanish outreach fairly soon. And again, we're also partnering with NCO to do some additional targeted outreach.
Right. Is there time at this event for a briefing from the public health officer?
I was not planning to give a briefing today because we're focusing on enforcement.
And so up next, we have Matt with KMED.
Hey, thank you everybody for gathering around the round table, the digital round table here. This might be specific to Mr. Burks and the code enforcement. Maybe some of the other individuals in the group could speak to it. So I spent the morning calling around some local grocery stores about enforcing masks inside of their businesses. Two of the businesses I spoke with described an inability to ask for verification of an individual's claimed medical exemption from the masking order due to concerns associated with like HIPAA and the Americans with Disabilities Act. Basically, to ask for those, for like a doctor's note would be a breach of privacy, was the assertion. And yet, the masking orders in the county say that individuals bear the burden to demonstrate the basis for the exemption. Okay, so with these two pieces, are these local businesses correct that these privacy concerns stop them from being able to verify the exemption? And if they are correct, does this leave a giant loophole that individuals can take advantage of essentially and not wear masks?
I'll just respond quickly and say that most of the larger grocery stores are within city limits. So I haven't really had too many complaints as it pertains to a large size grocery store. Some of the convenience stores that we approached had mentioned employee-wise that they had an employee that for one reason or another may not be able to wear, a facial covering. And out of those that we had, there were accommodations made so that that person was not dealing directly with the public, like, for example, in a retail cashier situation where they have to be so close. So they were just moved to a different operation. And a couple of the businesses that we spoke with had decided to close because they did not feel that they could comply. And that was, their choice. But we did attempt to help and educate in those circumstances. So unfortunately, I don't know if I'll be able to respond directly further to your question, as I've not really had a lot of practical experience with that.
I guess at the heart of my question is the convergence of HIPAA and privacy and ADA laws, and how whether they restrict a business's ability from being able to verify a claimed medical exemption. And as the masking order states, the individual who claims the masking exemption bears the burden for the basis of the exemption. So is that burden shown or proven later in like a court circumstance? I'm just trying to navigate how those businesses and the tools they have to enforce.
This is John Martier from the SIU unit, and as far the business owner isn't going to be able to demand any medical information or a medical verification. Although I've had some people that have had a doctor's note on them and have freely presented that. I believe the intention of that ordinance in saying that it's up to them to bear that responsibility would be if they were to receive a citation where the officer under their discretion felt that maybe there was no viable excuse, and if they were to receive a citation, then later on in the appeal process, this is just an infraction. So whether the initial appeal with code enforcement or if it goes to court, then they would have to substantiate their medical claim. But unfortunately, and we're not seeing this right now, you always could have the possibility of individuals taking advantage in claiming a medical issue when in fact they didn't. But unfortunately, at the retail level, stores just aren't going to be able to verify that. We would have to take the person's word at that point in time.
Thank you for addressing that question. And then this might be for Dr. Duhan. My next question, and it just has to do with the status of Mendocino County on the state watch list. I've had some listeners report that online Mendocino County still hasn't officially been appeared on the state watch list. Is that still in action? Just any updates regarding that process would be appreciated.
Yeah, thank you for that question. It's very important. There is a situation across the state of California where local jurisdictions are seeing certain data, and that data is not being seen at the state level. So what we are seeing at the Mendocino County level is data that would qualify us for the watch list. But then when we are in contact with the state, they're not seeing our numbers being as high as we're seeing on the front lines. To be on the watch list, we need to have 100 new cases per 100,000 people in 14 days. So that would be 90 new cases in 14 days. And we have exceeded that. But the state isn't seeing those numbers being as high. And so we did an analysis with the state and discovered that the problem had to do with reporting the data by the laboratories in our county up to the state through a system called CalReady. So the county gets faxes from the different laboratories telling us about a positive report of a case, but that report has to also go into the system called CalReady, which is what the state looks at. This has been a situation across the state that there's been mismatches in reporting through CalReady. So while we know what the data is on our front lines, the state is not seeing that data being as high as we're seeing it. And for that reason, we are not on the state watch list at this time. We're having regular meetings with the state and we're reporting the data that we're seeing, but we are officially not on the watch list. That is the reality. And we're waiting to see when our data is going to catch up to the state level, but we don't know when and if it will. So an interesting fact is that right now we're seeing what seems to be, it's too early to say, but perhaps a bit of a downturn in our numbers, which is very good, that we're thinking maybe what we were seeing was a surge from 4th of July gatherings. So as we watch the data, we're thinking that 4th of July was fueling the surge that we were seeing. And maybe because of this great enforcement support, we're seeing less gatherings and a downturning of our data, which would be very, very good news, especially given right now we have exceeded Humboldt County's numbers and we've exceeded Lake County's numbers. So here we're quite alarmed with those numbers, but we're hopeful that with this additional enforcement and containment of gatherings, we might have some better news in the weeks to come.
Thank you, Dr. Duhan. Thank you, Roundtable. I'll take my questions off air. Thank you.
Next up, we have Adrian Bowman with the Mendocino Voice.
How you doing? I apologize if this question was already asked. I had a problem with my computer and missed Sarah's questions. So just tell me if this has already been asked. Can you comment on the 3 nursing homes, Inland and Ukiah and Willits, that have had positive cases? In particular, the Willits home has declined to divulge whether it was a worker or a patient that tested positive, or any kind of numbers around that. Do you have any numbers with that, and who it was that got sick and what actions are being taken?
So I can take this first and ask for Becky Emery to confirm, but we did speak about Sherwood Oaks. Regarding the other congregate care settings, they've been in one worker. So an outbreak is defined by the state of California as one resident. If you have just one resident in a congregate setting, then it is defined as an outbreak. But these were workers that are now in isolation. So I don't know, Becky, if you have any more information about the congregate homes.
Certainly, thank you, Dr. Duhan. So just to be clear, they're congregate homes. We're not clarifying or stating that they are skilled nursing facilities. So I just want to be really clear on that. Additionally, yes, they are employees within the facility settings that we have been working with and working with those facilities to provide additional testing in order to be able to be proactive in these efforts. And so at this point, given that they haven't risen to the level of outreach, it would not be appropriate for me to state what facilities.
Outbreak, yeah.
So it was stated that it was Ukiah Acute Post-Acute Care, Mountain View, and Willits. In Willits, it was Redwood Center, the Redwood Creek Center. That information already went out from the county. Can you specify if it was one employee at each place or multiple employees at each place? One at each place.
That's correct.
Okay.
Not individual.
Employees.
Thank you for that. My second question is, let's see, which one do I want? My second question is, what is the current training regimen, collaboration going on between you, Dr. Duhan, and the incoming public health officer, Dr. Korn, I believe is how his name is pronounced. Are you, because he mentioned at last Friday's meeting that he had a lot of learning to do and a lot of catching up to do, and that he did not actually have specific training in public health the way that you do. Can you describe a little bit about the work that you're doing with him to bring him up to speed?
Sure. So Dr. Koren is not starting working for the county for about another month. And so what I've done is I've given him some recommendations about ways that he can educate himself in advance of starting the role. I know he's already started having conversations, but also to say that a family doctor who works both in the clinic setting and in nursing homes and in the hospital, as Dr. Koren has done throughout his career, who's a local, very connected doctor in our county, and who also has served in capacities with the public health department, with HHSA in the past, he's a very humble man, but he has a lot more training for this role than we might have stated in prior, conversations. So he, being a full scope, as we call it, family doctor who's served in positions in the past with the county as a volunteer, he is very, very well prepared. But for example, I've been asking him to focus his preparation in the beginning on skilled nursing facilities and on schools. There's a lot at the state level, which really it's the state level that regulates the schools and the skilled nursing facilities. I've asked him to take a deep dive into those areas and become educated in those domains. And then of course, I'm going to be remaining as a consultant until December 31st, and I will be supporting him until that time.
Thank you. It was 2 questions today, right? All right, thank you.
So that concludes our press portion of this event. So I just want to give CEO Angelo, Dr. Duhan, and our panelists any last comments before we leave today.
Yeah, Sarah, perhaps one last question for Dr. Duhan. Dr. Duhan, could you tell us how you think enforcement is going, and given your position on calls with counterparts in other counties, how are we doing relative to the rest of the state, and where can we do better?
I will say that I'm very proud of us for what we've done for enforcement. We've come together from very different perspectives. I really appreciate how our sheriff has talked at, we've all taken different oaths, but around COVID, our oaths are intersecting as we look to protect our county's health. So I think where we're standing right now, and the reason why I asked for this media day to be focused on enforcement, because I'm very proud of us for where we are standing right now. I don't think we have enough information from the data for me to say this with certainty, but as I said earlier, I do believe that our data is showing that what we saw in our surge, which put us on the watch list by our data, was coming from 4th of July. And the fact that we may be seeing a downturn in those numbers, which would be an incredible thing because generally other counties don't see a downturn. They just keep going up, up, up. I think that's because of enforcement. So if we've been having gatherings on 4th of July and now we're seeing a kind of a breathing space of not having the acceleration in cases, I think that's due to the strong work being represented here around enforcement. Our greatest weakness is with gatherings. This is where we have the wildfires spreading. So to the extent that we can stop gatherings from occurring that are not allowed, and again, the state has put the line at we are allowed to have gatherings in places of worship, for funerals and memorials, and for protest. And that limit is for 100 people, and these need to occur outside. So moving forward, these are the only allowed gatherings outside places of worship, protest or funerals / memorials. Any other gatherings that are occurring that are not in this category would not be allowed. And so I'm very grateful that we have a plan for enforcement.
Sarah, I had a question, if I may ask. Okay, during this last hour or so, one of the key points that was brought up to me, which I think is actually a really good question and should be answered if we can answer it, is that we know that we have community spread where we have the most people. So we are looking at Ukiah as an area where there are gatherings. We're attempting to stop those gatherings, attempting to do more outreach, education, and obviously policing within the Ukiah Valley. So we put this panel together, but we did not invite the police departments. We didn't invite Captain Wyatt or Captain Nolte or the Willits PD. And so, I guess I would like to ask Sheriff Kendall and possibly John Martier or John Burks if they would like to comment. So the question is that all three of you have alluded to a very good and close working relationship with the cities, and that all arms of law enforcement are working collectively during this pandemic. So could you elaborate a little bit more on that? And if we do another panel around enforcement, or were we remiss in not inviting the cities on this panel? Is there something we could be doing more or better? What is your sense of the working relationship? Maybe we should have had the city of Ukiah on this panel. I'm asking the questions. If we could start maybe with Sheriff Kendall. Thank you.
Thank you, CEO Angela. The police chiefs and the sheriff throughout Mendocino County's history have always worked together. None of us have enough resources by ourselves whenever we have an emergency, and therefore we've always relied on each other because our goals are the same, and it's always public safety. Last Friday night, Chief Wyatt got a hold of me because he had a gathering, and I pledged to him to assist in any way I could with the deputies who were available. I know that he also spoke with Chief Martier, who made the exact same pledge to him. Chief Martier has been in our chiefs meetings. We've sat down and worked on the collaboration process so that we can all get through it. But due to our historical nature of working with each other on every crisis, it's kind of just a natural thing for us to do. And I don't want to speak for Chief Martier, but I think that every time that we sit down to look at the problems as they morph and they change, then we come up with solutions based on what we're seeing at that time. And then we always try to think a little bit ahead also. So we'll continue working together and we'll continue to support each other because our goals will always be the same. Thank you.
Thank you, Sheriff Kendall.
I had an additional comment. Heading into this media day, I started researching on the state website to see if there was clarity about what's opened and what's closed by the state orders. And I realized that there's a lack of clarity. So we put a document together that combines what is open and closed by the state, what is open and closed by the county, by my health officer orders. And that summary document, what's opened and what's closed and what's allowed with gatherings, is on our county website now. So because we can't have enforcement if we don't know what's open and what's closed, and we can't expect the public we can't punish them if it's not clear what is open and what's closed. So I don't know, Sarah, if you want to comment on that document we posted last night.
So both of that document is online in Spanish and English. We'll be posting it on social media later today, and we'll be doing some PSAs around our gatherings allowed and trying to provide some more information to the public based on that document.
Sarah, I understand there may be some effort to post physical flyers, given that not everybody is online. Can you talk a little bit about that, when that'll happen and what it'll look like?
Yes, we developed a lot of different flyers, really reiterating that masking is required and that there could be a fine of up to $100 minimum if you don't comply. So we have additional materials, and as our enforcement team goes out throughout the community, especially this weekend, you'll start to see those signs around town reminding folks that, safety first, please wear your mask, and there is a fine associated if you decide not to wear a mask when required in certain situations.
I think we have Ron that would also like to add to that question. Go ahead, Ron.
If I may, I will tell you that the Mask Up Mendo program and all the chambers are working with Sheriff Kendall. We're working with our local police departments on each one of the areas, regionals. We'll certainly work with Chief Martier if he would like us to kind of help out with information. We are working with the police departments and the law enforcement so that they can have our educational materials available, and so that they can be a little softer when they need to discuss this issue. So one nice thing about this collaboration is enforcement, education is working together so that we can better get our message across to people.
Well, unless there's any other comments or questions, Sarah?
Just thank you all for joining us today. For those of you that maybe joined early or late, we will be posting a recap of the highlights from today in English and Spanish later this afternoon, as well as the updated charts of what businesses are open and activities are allowed. So with that, thank you for joining us today. We'll see you guys again soon, and thank you to all of our panelists.